This is Dr. Gio. I'm an integrative cardiologist, and we're back once again on a crusade to wake up minds and break through barriers when it comes to taking care of yourself and your health. And once again, I'm joined by Devaki Lindsay Berkson, who is an all-around sweetheart, academic, gut specialist, author, passionate health advocate. Probably could fill a book with more adjectives if we really needed to. But
If
she
only you weren't married.
So we actually came up, or she came up with a great idea, is to discuss the gut-heart connection, which obviously that's close to my heart, so to speak. And and it's a common question that I get in my practice when people are coming in and, they had their calcium score, they had their heart attack, they had their stent, and the ones that don't question anything, they just accept the medications that they were put on. They had a heart attack. Well, that's the way the cookie crumbles. And there's other people that are saying, I'm really healthy. I eat well. I exercise. Why did this happen to me? Why did it happen? And a lot of times they're even reading deep enough into it where they're saying, why do I need to be on these medications that I'm on? And so I guess one of the things that I have to try to explain to them is, are those risks that we're always identifying the tail wagging the dog? Meaning, is blood pressure truly the problem? Is cholesterol truly the problem? Are your genetics the problem? Is smoking the problem? Is diabetes the problem? Is having a hypercoagulable state for some reason the problem? And yeah, they are problems, but they're not necessarily the root cause. So blood pressure a lot of times could be the result of other things happening in your body. Same thing with the cholesterol. And when I talk about cholesterol, I'm not so concerned about the raw numbers, but I'm more concerned about inflammatory cholesterol and how it's impacting your vasculature. And we do, and I think we're starting to make a breakthrough in cardiology where doctors are realizing they need to go beyond just looking at the LDL and the HDL and looking to see whether you have oxidized cholesterol around, which is a little bit riskier. But I don't think the understanding of where that's coming from is there yet. And then the other thing is when it comes to genetics, there's also epigenetics. So your genetics do not dictate that you're going to have a problem. But what you do in your environment and how your genetics express themselves is a big deal. Tobacco, I think, is a no-brainer. It's definitely something that's toxic to you, many organ systems in your body. And then I think more and more people have accepted that diabetes and pre-diabetes is a major issue. And then the hypercoagulable state is something that we're probably going to tap into here. But so when they're asking me, why did this happen? And we start to talk about things that lead to these states. And the gut is a big deal. And to me, the gut starts from the mouth all the way down to the rectum. And in the mouth is the first question that I go for, especially in the people who have had heart attacks. Have you had root canals? Do you have gingival disease? Do you have fillings? And then we finally get down to the stomach, the gut, and what's happening. So where do you stand on that potential connection, Devaki?
Oh, the gut now is the epicenter. It's the Star Trek, captain's quarters that has its tendrils into everything because the gut is the outside world in the middle of you and how you deal with it. If you don't deal with it optimally, you're inflamed. And we know from the Jupiter study, remember years ago, that came out saying we need to run a high sensitivity C-reactive protein because inflamed lining of blood vessels is a major driver of heart disease. So gut inflammation is linked to inflammation. End of story.
Yeah, and it's very clear that that's the case. And there are a lot of markers that we check in the integrative world that aren't really getting checked in the clinical cardiologic world. And that's going to be things beyond your apolipoprotein B, beyond your LP little a. Some people are starting to get more aggressive in checking oxidized LDL, which makes a lot of sense. But then when it comes to the gut connection, there are these compounds that not a lot of people test for, like TMAO. I'm not sure that, are you aware of any way to test for lipopolysaccharides in the bloodstream?
So this is a nasty molecule that when your gut wall is leaky can leave the inside of your gut and travel far and wide and create a lot of havoc. And you can test antibodies to lipopolysaccharide with Vibrant Health. And you can also test zonulin either in the blood or in a comprehensive stool test, because elevated zonulin is the marker. It's a protein that's like a hammer, and it hammers at your single-celled gut wall, and your gut wall then has holes in it. And when your gut wall has holes in it, most of the time, LPS, this very inflammatory molecule, is leaking through. So heart attack, I mean, most of us leave this incarnation through heart disease. As much as we're scared about breast cancer or we're scared about these other things, most of us exit with a heart attack or a stroke. And these nasty molecules are highly linked to having a higher risk of exiting your incarnation before your expiration date is up, which none of us want to do.
Right. And as much as we're trying to wake up the people that aren't physicians, I want the physicians to wake up too. And they may not remember LPS. LPS was one of the biggest things that you studied in microbiology, and they come from gram-negative cell walls. So if these gram-negatives start to die in your gut and your gut's leaky, you're absorbing lipopolysaccharides, which have a lot of vascular inflammation associated. So it just goes to show you that a leaky gut can be a very big connection to developing heart disease and all the other problems that happen after heart attacks as well. So and TMAO is an interesting one because we have a lot of people that are overweight and they go on the carnivore diet, and they're eating a lot of protein, they're staying away from fiber, they're not having a lot of vegetables, and when they have a dysbiosis as well, this compound sort of goes up. What do you know about TMAO?
Well, TMAO has a huge question mark over it. So the idea is there an association with heart disease, or is it actually cause heart disease? And the other issue is so TMAO stands for trimethylamine N oxide. I've been at lots and lots of conferences where experts talk about it, but they can't even pronounce that name because it's very polysyllabic. And it tends to be made in a gut that's got some issues between its good bacteria and its bad bacteria. But if you're going to test it in the blood, you can't eat fish for 7 days ahead of time because fish flesh is filled with TMAO. Fish use TMAO to be able to dive deep and withstand the pressure of the water. So if you run somebody's blood and they've gone out and had lobster, or I know in Naples, you're in Naples, Florida, they love grouper over there, and you've had a number of fish meals or tuna fish sandwich, you can then test your bloodstream and it can look ominously elevated when it's really just that you just ate fish flesh. So there's some ways that you need to go about testing TMAO. And we don't totally know, but we do know that in the medical literature, one of the things in the gut that is most statistically linked to a vulnerability of a fatal heart attack is very elevated TMAO. And the kidney heart access is a big new arena of medicine. I used to work in a dialysis center with Dr. Jack Moncrief, who co-invented the home unit of dialysis. And he would always say to me, the kidneys drive the heart, the kidneys drive the heart. Sick kidneys can't clear TMAO as well as healthy kidneys. And then the higher your TMA goes, let's say not because of fish, but because your gut is making it, your unhealthy gut is making it, then that worsens the kidney and worsens the heart. In fact, TMAO might be one of the links between the kidneys driving heart health. So TMAO is a controversial player because not everybody believes that it is a direct marker of heart issues. Some people say TMAO elevates if you have insulin insensitivity, but nonetheless, it's something that we need to track. And one of the ways that we can bring TMAO down, I have a gentleman that presently is in his mid-90s, and he has all these terrible markers in his blood, and he's got he almost is like the little old lady in a shoe. He's got tons of kids and tons of grandkids, and he's doing fabulously. But if you look at his blood looks terrible, and he looks wonderful. So what our lab looks doesn't always correlate with the patient, and we say always treat the patient more than the lab. But his TMAO was just sky high. He actually owns a number of hamburger places on the East Coast, and we thought maybe it was from beef. Leo Galland referred this gentleman to me. If you remember the old internist up in upstate New York. And Leo sent me some papers a few years ago that resveratrol can lower TMAO. And so we just let this gentleman keep eating his hamburgers and gave him a fair amount of resveratrol twice a day. And lo and behold, it brought it right down. So resveratrol as a plant compound does some beneficial things to the gut that allows your body to have a better optimal level of TMAO.
So great biohack. Great biohack. So you should probably be taking some TMAO when you're eating a lot of fish and you're eating a lot of meat, and let alone just try to keep your gut as healthy as possible.
Take some resveratrol, I think you meant to
Yeah.
say. Yeah.
Oh, sorry about that. Yeah,
I
resveratrol.
think you said take some TMAO. I don't think we're
Oh,
going to
no,
go buy
no.
some TMAO.
Thank you so much. Yeah, resveratrol is
Okay.
what I'm talking about, and so it's a great biohack. And then the other thing that is interesting is the how cholesterol gets processed. Bile acids can actually go through a big step when they're traveling through the gut to get metabolized, and if they don't get metabolized past a certain phase, you can actually boost the precursor that you need in order to produce more cholesterol. And if you're actually having gut issues, that tends to be more inflammatory cholesterol that's present. So do you tend to see a lot of bile acid metabolism problems when people have gut issues?
I do, and I almost always run a comprehensive stool test so I can get an idea that looks at the fat, the steatorrhea in the stool or not. We know that bile acids, when they're optimal, are good, and when they're not optimal, the secondary bile acids or the level of bile acids are not optimal, that they're bad. But there is also a biohacking bile acids. One, if you've had your gallbladder out, by the way, you probably, so I took this incredible course one time with a functional gastroenterologist from the Cleveland Clinic, which of course was one of the main first functional clinics, other than the one that I originally worked with in Palo Alto. And he showed us fluoroscopies of the inside of what was going on in the gut of people who had their gallbladder removed. Because the liver makes your bile acid, and the gallbladder is the piggy bank that stores it, and then it gets signals from higher up in your digestive tract when food comes in and chewing occurs, and the stomach gets activated to squeeze that gallbladder to let bile go in. So you only are supposed to squeeze it when you have a meal with fat, when you take fat-soluble vitamins. But people who don't have a gallbladder, they don't have a piggy bank. So the liver makes it, and it's drip, 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 dripping all the time. And he showed us in a video of this happening in a number of patients with this chronic drip of bile acids. And that's why I think there's a number of papers out that people who get their gallbladder removed have a higher incidence of colorectal cancer. And then there's some patients that don't support that. And I think it's because some people's biomes and gut can absorb and handle that drip of bile acid. And it's no big shakes for them because they eat well, they exercise, they take probiotics. They can manage that drip of bile acid, whereas other people can't. But you do want, when somebody gets a colonoscopy, I always ask the gastroenterologist to take a picture of the stomach. I want to know if the bile acid is refluxing up into the stomach. You kind of always want to know. It's 11 o'clock at night. Remember that old saying, where are your kids? Do you know where your kids are? A good physician will say, here you are in front of me. I want to know where your bile is. Is your bile doing what it should do? When it's doing well, it helps you digest and keep things healthy. But when it's not, you're at more vulnerability for a variety of things.
So what's the biohack?
Oh, so the biohack, what I was just going to say, the biohack of that.
We were talking about
Yeah. I got it.
Okay.
I retrieved it in this gray matter. Okay. So one of the things that really helps keep your gut healthy, your heart healthy, is an anti-inflammatory agent that nature meant for us to have. And it even keeps your gut wall healthy. And these are called short chain fatty acids, especially butyrate.
Yeah.
The olden days, my mother thought her doctor was God, and she went off butter and she went on margarine. Margarine was trans fatty acids, and she gave up the butyrate and butter, natural butter. And then if you buy ghee these days, which is clarified butter, just butter with the milk proteins removed, is just filled with butyrate. We give all cancer patients, any seriously ill patient, butyrate because butyrate lowers inflammation. It's one of the most powerful anti-inflammatory agents we have. So if bile is an issue, if you supplement with butyrate, the supplement and also the foods, that helps deal with the negative downstream issues of bile issues. So that's a bile biohack. That was a
So
mouthful.
that was good. That was good. So it really just to try to make little micro connections. So what's really interesting is that when you're having problems with bile acid dysregulation, in the regular medical world, they'll give you these bile acid resins to try to lower your cholesterol because if you don't, that improper processing of the bile acid will actually raise your cholesterol level. So that's where that comes from. And this bile acid metabolism dysregulation that's present boosts a lot of IL-6. So at least cardiologists know this, and hopefully I'm educating people about what IL-6 does. It goes to the liver, it becomes cardiac CRP. So, and that's the marker that tells us that there is some level of vascular inflammation occurring. And IL-6 may be a consequence of the fatty buildup, or it could be spurring the process of the fatty buildup. And what's really interesting is that short chain fatty acids actually drop your IL-6 and TNF alpha. So that's really powerful stuff. So it's really interesting, right? So a gut dysbiosis is causing vascular problems. So there's really a gut-heart connection that's real. How many cardiac patients are getting stool tests? Not many.
Oh, almost nobody, or they'll get an O&P, an old time. In fact, when I used to lecture a lot at A4M in the gut module with Jill Carnahan and Dr. Sam Rabar. In fact, we're getting together next year and putting on a gastroenterology event. And Jill said that she took some O&P kits and had some patients put their poop in it. And, it's a basic poop test that most people feel is a poop test. And she put some pathogens in there. She stuck some worms and things and sent it off to the laboratory, and they never even found it. Those
Oh,
tests
really?
are so poorly done. I'll never forget that lecture. And Jill's extraordinary. Just, she specializes in heart and breast cancer because she had inflammatory bowel disease after she went through chemo for breast cancer right at the end of her med school jaunt. So I really listen to what Dr. Carnahan has to
And I
say.
got to tell you, I want to reinforce that because there are many times where I'm talking about the gut to my cardiac patients. Oh yeah, I went to my gastroenterologist and they did a stool test and we look it up. It's an O&P. There's no information there about what's happening with your pancreatic enzymes, what's going on with your short chain fatty acids. Do you have a dysbiosis? Are your gut bacteria in balance? And these things play a major role in your overall health. But my bias, of course, is in cardiovascular. So to me, that's a really big deal that you do a full evaluation. And now there's other short chain fatty acids too, besides butyrate. So propionate also, which is really interesting. It actually inhibits HMG-CoA, which is what statins presumably do, right? And they do it
So
in a
do you
much healthier
supplement
way.
with that in practice?
Short chain fatty acids for all gut. I'm not going to necessarily put somebody on a short chain fatty acid unless I identify a gut problem. I'm going to put them on resveratrol for sure, but I could always change that because I don't think there's a lot of proof behind just giving people short chain fatty acids will reduce cardiovascular disease, but it has so many other health benefits.
There in peer review literature, there's
Yeah.
papers coming out on that. It's crazy.
That's great. So and that's something that's very important. And if you do have a dysbiosis, you're sort of a lot like methylene blue bypasses the Krebs cycle to give your mitochondria energy. Short chain fatty acids bypass the dysbiosis to make sure that you're staying healthy and your immune system's doing well. So that's not a bad biohack, I think. That's a good option.
You know what's interesting to me? So Thorne is a very well-respected doctor's nutraceutical line.
Mhm.
And Al Zapp was the president of Thorne. He started it. And I've been in practice for almost 50 plus years. And Al Zapp has been considered one of the geniuses in our industry forever. So when he sold Thorne, he had a non-compete clause and he decided to stay in his garage and make this little suite of products that were the most important products he could think of with the best delivery system. They were going to mostly focus on cancer because he had so many close friends and family members that had cancer. And the very first product that Al Zapp, one of our geniuses of our industry, made was a short chain fatty acid, and it's called probutyrate.
I
And
use it
I
all the
use,
time. I love
okay,
this stuff.
that's Al's product.
Yeah.
Okay.
It's
By the
really one of the
company
few products
Tesseract.
out there. It's one of the few products out there that'll actually supplement your short chain fatty acids. I love
Right,
it.
right. I have
So
a question for you though.
sure.
Okay, so this is going to be coming from the other side. So I've been meaning to get connected with you and ask you this question. So everybody talks about cholesterol like it's the enemy. And in the Women's Health Initiative, they didn't just check hormone levels in women. The Women's Health Initiative was put together by our government because we're an aging nation and we didn't want to topple Medicare. So 40 prestigious, supposedly, I don't think they're prestigious anymore, institutions like Harvard came together. I'm very unhappy with Harvard, came together and they looked at women every which way. So one of the things they did was look at cholesterol, and all the women they dealt with were Medicare. So they had all the records. These women are 65 and older. So they did the most elegant study. It was published, I think, in Climacteric in 2022. It was extraordinary. They started with almost 200,000 women, and they tracked them to see who lived to their mid 90s with no heart attack, no stroke, and ease of mobility. And then they looked at their total cholesterol, the HDL cholesterol, and their LDL cholesterol. And they started with 200,000 women, and they ended up with a little under 5,000 women that made it to their 90s. This was a long-term trial. You don't see many studies like this. And the women that lived the best, that didn't exit this incarnation from a heart attack or stroke, were the women that had the highest level of LDL. It had nothing to do with HDLs, and it had nothing to do with total cholesterol. So I would love you, since I really respect you and look up to you, if you could comment on that study.
Yeah, I think it all comes down to inflammatory cholesterol. Such a vague term that I'm spitting out, but looking at oxidized LDL and what it does compared to LDL, which is meant to be a carrier protein for all your fat soluble vitamins. I mean, that's why your liver packages stuff with LDL to get it around the body. So LDL is not, and by the way, LDL is not bad cholesterol. I really wish people would stop saying that. It's a lipoprotein, it's a carrier protein. And the HDL is what's responsible for bringing everything back to the liver for reprocessing. So LDL is not bad for you. So all these DNA and RNA type medications that are coming out now, where people are getting one injection just to drop their LDLs very low.
Worries
Um,
me.
it worries me tremendously because
Worries me.
you need that to be around. But a focus on inflammation, what's causing the inflammatory markers that we usually check in cardiology to go up, what's causing your oxidized LDL to be up, those things are way more important. And as is evident, your sugar control dictates more the higher likelihood for having vascular disease. So those glycation end products are very inflammatory. That should be dealt with. And there's people walking around in their 50s with hemoglobin A1Cs of 5.8, 5.7. They're not diabetic, they're pre-diabetic, but they're insulin resistant. Insulin in and of itself at high levels is highly inflammatory. These are the bigger culprits. And I suspect when you look at that and go back and look at that study, they did not look at these kinds of markers back then. They didn't quite make that connection. So LDL is not the problem. Inflammatory cholesterol and other inflammatory markers and things that cause that inflammation are the problem. So case in point, tons of people with total cholesterols over 300, more often than not, their LDLs are like 200, 250, and they have no coronary disease, no carotid disease. It's unreal, but they're not inflamed when you check. So, and there's other people that will have the same cholesterol. They'll have disease, but they have a lot of inflammation going on. Flip side, you could have people with completely what's considered normal cholesterol, which is nonsense because they've been dropping that number tremendously over the decades. And they'll be filled with coronary artery disease, and yet their cholesterol is great. Why is that? Because they haven't controlled inflammation. So cholesterol is some sort of a marker, but if you look deeper, the more inflammatory components of cholesterol are probably more important. Triglycerides are a case in point, right? So triglycerides have a bigger connection to flourishing soft plaque that can lead to a coronary event, so much so that it was recently recognized that fish oil is very powerful in reducing the risk when you reduce your triglycerides. So, and sometime in the past, niacin got kicked to the side. And I always tell this story. I got to tell history because history tells a lot, right? So before statins were around, niacin was one of the primary ways you could actually control cholesterol. And the biggest problem with niacin was that you had to keep pumping up the dose. And if you weren't using slow release versions or things that blocked the flush reaction that you would have a problem. So it was a very complicated dietary way of taking it. You'd have to take it at bedtime. You'd have to take it with a full aspirin. You'd have to take it with some yogurt. And that's how you would prevent the flushing reaction. Yet it was considered so powerful that simvastatin decided to pair up with niacin. And when their studies came out, they showed more plaque regression with that combination than they did with statins alone. That's powerful. That's very powerful. So niacin is just a simple vitamin. It's B3, and it has a lot to do with your cardiovascular health, your brain health, etc.
But you know what's also interesting? So I just, I formulate supplements too, and formulated a woman's line for biotics. And one of the real important things I put in there was full flush niacin. And the reason I put full flush niacin in there is one, it helps the body metabolize in a more ideal way cholesterol, but it helps you make from cholesterol and pregnenolone to take that parent compound and make estrogen out of it and testosterone out of it. And what do we know that runs our entire digestive tract from north to south? Our gums, our esophagus, our digestive tract. There's receptors that take signals from estrogen and testosterone. We want estrogen, and that's why older people with less estrogen and testosterone have more dry mouth, have more periodontal disease, because you don't have these hormones. But if you're on nystatin, it helps you with the cholesterol. But part of the way it helps you is it revs up. I mean, niacin, thank you. Same thing that you do. Yeah, it's easy to get turned around when you're talking.
Yeah.
Yeah.
So
thank
when
you.
Okay.
So
And niacin?
yeah, so part of the benefit is that it's helping rev up a little bit more hormonal activity that a lot of us are not having when we're older.
Right. That's a good point. A good point. And so, I've talked about teeth before. We really didn't address it. And, most people don't consider the mouth, the gut, but dental health is extremely important. So if you have fillings, make sure you're getting your metal analysis, especially if it's metal amalgams that are part of your fillings. Although a lot of dentists don't believe in cavitations, get evaluated for those things because they could be a focus where infections are building with mouth bacteria that are known to be very vascular toxic. And especially root canals. Root canals are tied to a higher incidence of heart attack after a root canal compared to a dental extraction, almost a five-fold increase. So I'm very careful to take a dental history, especially when somebody's had a heart attack. So I can't stress enough that once in a while, go get that cone CT, see what's going on with your gums and your teeth. And if you have metals, at the very least, get evaluated to see what kind of metals are floating around in your system, and give some consideration to getting those metal amalgams out of there, because they are very irritating to the blood vessels.
Totally. I'm the keynote speaker for this biologic dentistry meeting in Greenville, South Carolina in September, because my biologic dentist, Griffin Cole, called me up and said, we want you to come here and talk about the teeth oral heart connection. So I'm speaking for a whole group of dentists on that. That's going to be really interesting. Anyway,
That's great. That's great.
because everybody, there's so many ways to look at it, but it's honestly, rather than get overwhelmed, it's honestly just common sense. What in your body is causing inflammation, and how do we just tamp it down? And there's many different ways. It's kind of like when you clean your house, you have lots of nooks and crannies that have to be cleaned. You've got closets, you've got the dishes in the sink. There's lots of things that have to be dealt with. And you're moving through life in your bodysuit, and there's lots of nooks and crannies. So rather than feel a little bit overwhelmed by it, it's just a way of finding out where some inflammation is stuck in a corner and letting the sun shine in on it and deal with it, rather than have it be a hidden villain and suddenly end up with, people come in with a diagnosis and they go, I've done everything right. I eat right, I exercise, I've done everything right. But we don't really, it's not part of regular medicine to figure out how to look into your nooks and crannies. And I think that's what root cause functional medicine is about, is let's look into your nooks and crannies and see where we can see some hidden inflammation and try and help you out with it.
It's absolutely true. Absolutely true. Out of curiosity, how often do you see a patient who has no gut symptoms whatsoever, but their gut is horrible?
Oh, but their gut is horrible.
Yeah.
I
Does
was
that
just
ever
going to tell
happen?
you, I had one woman who had no symptoms, but she had a lot of plastic surgery the year before I saw her. And the plastic surgeons put you on a lot of antibiotics. So it's usually linked to a history of a lot of antibiotics or prednisone and steroid use, and
Mhm.
they don't have the symptoms yet, but when you run a comprehensive stool test, it comes back like that. But it's rare because most of the time, but also, if people live really cleanly, you can have nooks and crannies that are dirty and whatever, and you can still live a good life with it because, we have redundant backup systems. And the more you take care of yourself on more and more levels, you can have places that you never find that nook and cranny, and you can deal with it because your body is so healthy, it can deal with it. But it's not typical. But I had a real, these days I focus on breast cancer and kidney disease. And I had this young woman who was a nutritional therapist, lovely young woman. She was only like something like 29 or 30. She had no issues. She had great transit time. She'd never been on an antibiotic in her life. She was born just a few miles away from a mom that milked goats and just that kind of living. And all of a sudden, she's breastfeeding a 2-year-old kid and she's got inflammatory, which is aggressive breast cancer. So if you look at everything in the body and nothing shows up, my next question for her was, well, where do you live and what are you surrounded by and what's your environment like? And it turned out that she was living in the country surrounded by cornfields and wheat fields and soy fields, and all of them were heavily sprayed. And her mom was 4 miles down the road, and she was raised in an area that reminds me of a book when I was at Tulane and I was a distinguished hormone scholar at the estrogen think tank. We had a woman named Sandra Steingraber, and she'd come in and she'd say, I'm Sandra, and when I was 23, I had bladder cancer. My brother, when he was 28, he had bladder cancer. My uncle had bladder cancer, and my aunt had bladder cancer. And the kicker of it is my brother and I were both adopted. And it turned out that she was living in an environment that was heavily sprayed, and the name of her book was called Living Downstream. So there's an internal environment that the good functional doc, like you're amazing to be a functional cardiologist, that's very rare. And you're looking into all the nooks and crannies in the terrain of the patient. And then we also have to do a bit of a look to what you're living in, because it's not just a Seinfeldian bubble, but it could be very toxic. So we got to look at all the parts of life that make you you and see what's working for you and what's not working for you.
Right. And that's and the people who do have something cooking but hasn't manifested with clinical symptoms, that's where mitochondrial function is very important. So mitochondrial insufficiency, meaning you're overwhelming your mitochondria and its ability to sort of produce energy, adjust how your immune system's behaving, how it's reproducing, that dictates how many problems you can handle. So if you have somebody that's got a lot of Roundup exposure and they have mercury fillings and they have a leaky gut, that person is going to get their mitochondria overwhelmed a little bit faster and they're going to start having symptoms. And it's not impossible to turn around, but you have to identify what's happening at the root. And that's why I love things like ozone therapy and hyperbaric therapy and methylene blue. All that stuff is wonderful stuff. So I have one thing that I know that the majority of the world loves, even though they know it's bad for them, and that is aspartame.
Oh
So
God, I was thinking you were going to say chocolate.
yeah, no,
So
that
aspartame?
we want that around. But aspartame is a biggie, right? Because it when it does get metabolized in the gut, and especially when there's a dysbiosis present, you start to produce a lot of this phenylacetate glutamine, which I think they, for sure it's like a pagan or a pageant. I'm not sure if people call that abbreviation anything, but it's amazing how vascular toxic it is. It loves to boost platelet stickiness. So in people who do have plaques around, they're going to have a higher risk event when that happens. And then last but not least, you actually are producing methanol when you're breaking down aspartame. So you drink enough aspartame, you're definitely going to have an issue with your optic nerve and your eyes in general. So, and that's a biggie. I think by now, aspartame should not be in any of our beverages. And in Europe, you have many, many choices. Here, it's constantly, even when there's sugar in an item, they will put aspartame in for the sweetener, just for the heck of it. So that's something that people should
Boy,
go out of their way to avoid.
you just explained something for me that I've wondered for a long time. So I read an article in the journal, the JAMA Ophthalmology Journal, where a number of ophthalmologists noticed. So you have a normal pressure or high blood pressure in your optic nerve, and people with glaucoma can have altered pressures. And elevated pressures aren't good. They put a lot of stress on your optic nerve. And they noticed that people that took carnitine and choline in supplements were having elevated pressure in and that was an issue. And I actually did a radio show on this in Tulsa, Oklahoma, and one day when I was seeing patients over there, all of a sudden somebody came in with a huge plant into my office, and they were delivering this plant gift. And it turns out that this woman had just moved, and she'd hurt her joints from moving, so she was taking glucosamine. That's the deal. It was glucosamine and carnitine and choline. And she was doing that because she hurt herself moving. And then when she stopped that, her pressures normalized. Could that have to do with that molecule that you're talking about?
Well,
Is that what that
so
is?
glucosamine and chondroitin, right, which tend to be sort of
Right.
improvers, are not, it's not necessarily associated with aspartame. I'm not aware of
Okay.
any connection
But
there.
for some reason, they can elevate IOP, the intraocular pressure, in people who have intraocular pressure issues, not in people who don't. But I was just wondering if that molecule, whose name I cannot repeat because it was a new name to me, that PAG, it's the PAG, right?
Yeah,
The buildup.
PAG in, PAG, yeah. So the thing is I'm not, there's no connection, I think, with glucosamine.
Okay, okay. I
However, there is a
retract that.
connection between excessive L-carnitine and a dysbiosis causing vascular inflammation. And
Oh,
more than
interesting,
likely,
because that elevates TMAO.
that's where I think the connection is. And
Okay.
one of the other things that people should be doing in their history taking, they should be asking, do you have cataracts? Do you have glaucoma? Do you have macular degeneration? Again, the eye is this one place where, without cutting anything open, you can look at a vein, an artery, and a nerve and learn a lot about people. And although the eye doesn't react the same way as the rest of the body, these three things are definitely associated with vascular disease, whether it's the coronaries or elsewhere. So when you're hearing people have glaucoma issues, you know that's a microvascular issue, and these people are at a higher risk of having a cardiovascular event.
I've got glaucoma. Every single person in my family has glaucoma.
Mhm.
I think something like 30 people. And I interviewed on my podcast Dr. Richie Rich, who is the world's expert on glaucoma. He said there's 500 genes for it. He said
Mhm.
most people think there's much less, but that's very interesting to me. Very
Yeah.
interesting to me.
And out of all those
But
things, macular degeneration has the highest risk for cardiovascular disease.
does it?
Yeah.
Macular
Yeah,
degeneration?
they call it the stroke of the eye.
Oh, interesting. I did
Yeah.
not know that. I learn
Yeah.
as much chatting with you on these shows as hopefully whoever is out there, hopefully they're learning some things from us.
Well,
But
that's why I love
I
having
love
you
that
on. We
my
learn
tool
from each
bag is
other.
big. Yeah, I love hanging out with you. You have great energy and you're always right on the tip of new things. And I love the way our conversations just, we never know where they'll go. So thanks for being such a cool guy.
Thank you for coming on board. But so I want some solutions, right? So you gave us a really good one. There was resveratrol. That was awesome. Short chain fatty acids, I think an awesome thing as a potential add-on for people who are supplementing. But honest, and by the way, nitric oxide, very big deal. So anything you can do to boost your nitric oxide levels, even if
Well,
you have vascular disease, is
Well,
important.
estrogen in women and testosterone in men boosts nitric oxide. That's why we get partially one of the reasons that as our hormones wane, we have a higher risk of heart disease because they boost the expansion and health, the flexibility of blood vessels.
Mhm.
So hormone replacement therapy is helpful for nitric oxide. But I do have a favorite product that's supposed to help boost the release of nitric oxide longer right now than any other product, proven by Mark Houston's office over there. He's got the Hypertensive Institute of Nashville, and it's by Calroy, and it's called Vascanox. Do you know about Vascanox?
Absolutely. It's been around a long long time. There's a variety of products out there that do a great job. So Vascanox, Cardio Miracle, even here, this is one I like because I could take an extra capsule every once in a while. Approved Medical Solutions has a really good product also. And there isn't the cardiac patient that doesn't come by that I don't do a nitric oxide test strip on them just to show that they're not really doing a good job supplementing a very important signaling molecule. So, with the TMAO, I'm sorry, you were going to say something?
Well, I think that if people have had their gallbladder removed, you
Mhm.
really need to consider taking some bile acid replacement because you have a drip, 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 as we said, but you don't have enough of a huge bolus of a release during a fatty meal when you want to absorb your vitamin D, your vitamin A, your vitamin K, your fat soluble vitamins, and your fish oil and fatty components in food. So I do
Or your
think that
vitamin D.
bile acid, yes, definitely. I think bile acid replacement is very important. There's 500,000 gallbladders removed every year, and nobody ever says anything to these people about, hey, with your largest meal, you ought to consider taking some extra bile acid now.
What do you think of TUDCA?
I don't know about that.
So it's
What's,
trans-urso deoxycholic acid.
oh,
And
okay.
yeah, so it actually can
Why
boost
don't,
bile acid, bile flow.
I don't know about that. So can
Yeah.
you share with that?
Yeah, I think it's fallen into the supplement realm. I remember back in the late 1980s, early 1990s, the medical industry or the pharmaceutical industry came out with ursodeoxycholic acid. So they found it as a way to increase bile flow through the gallbladder and melt gallstones. And it was met with variable results. So for the intent of trying to make a gallstone shrink and not have to go through gallbladder surgery, it ended up falling out of favor and it's no longer used. But in the integrative world, people are still using TUDCA, which is a version of this deoxycholic acid, which is an essential thing for spurring on bile flow and production. So in people who don't have a gallbladder or a reservoir that they're producing, if they're making the liver constantly produce it, it's increasing that bile pressure going through the sphincter of Oddi into the small intestines. So that's something that we tend to use when we have people that are showing issues with fat malabsorption, along with the pancreatic enzymes and along with increasing their acid production in their stomach.
Yeah, the acid is so important.
Mhm.
In the 1940s, when there was a lot of research about the importance of stomach acid and what makes the parietal cells shut down from making stomach acid and what doesn't, it's stomach acid is what gets the gallbladder to contract. So there was a lot of research by a researcher in the 1940s and 50s named Dr. Cook, and he said gallstone formation is the flashing red light that you're not making enough stomach acid because that produces cholecystokinin, which then says to the gallbladder to squeeze, and you're not getting that initial signal to tell the gallbladder to squeeze, and also food sensitivities. So I think there's lots of we knew this stuff way back when, but when
Mhm.
cortisone came on and big pharma got the presence in all of our lives as it has, we've moved away from the natural physiologic answers to the more pharmacologic answers, and we're all paying a big price for it.
Yeah, and if you really think about it, is it truly that we're doing more gallbladder surgeries because we're giving a lot of proton pump inhibitors and we're not making as much acid in the stomach because everybody suffers from
Yes.
reflux?
Thank you.
Uh,
Thank you.
yeah.
Thank you.
So a lot of it is actually a circular vicious. It's a vicious cycle that leads to more and more medical procedures, essentially. Yeah. What was
Oh,
another?
so you wanted to have some more hacks. You wanted some
Yeah,
more
yeah, that's what it was.
biohacks.
Okay. So
So, the big deal is to not get this leakage of LPS, lipoprotein polysaccharides, and other undigested foods and, multi large polypeptides, because you want your stomach to break them down into itty bitty, peptides or dipeptides or tripeptides. But if you don't have enough digestion health going on, you get these almost digested pieces of food swimming on into your bloodstream, which is a major cause of autoimmune disease. And so, one of the things you want to think of is so the gut wall is it's very weird that God designed the gut wall. That's the real wall between the outside world and the inside of us, just one cell thick. What a crazy thing. It's so vulnerable, but it opens and closes with sticky adhesive proteins.
Mhm.
And so the adhesive protein is very activated by zinc carnosine. There's lots of papers on this special form of zinc helping to close that. And also these sticky proteins, there's occludins, there's 44 occludins, and they're upregulated by progesterone. And then there's a whole branch of sticky proteins called junctional adhesive molecule A, and those are upregulated by estradiol and estriol. So one of the reasons that people on hormone replacement as they age have less gut issues is those hormones help make the gut wall, when it opens up, close back again. So you can either use zinc carnosine to help you as a biohack, or bioidentical hormone replacement, or even an estradiol patch, which is really micronized estrogen. So there are ways to make your gut wall behave better, and
Mhm.
they're not that complicated.
Maybe taking it up one notch on the complexity. Do you use peptides in your practice to promote gut health?
I'm just starting to get into it. I actually just spoke at the World Peptide Congress, and they wanted me to speak on the synergy between peptides and bioidentical hormones. And I said, I've never done this before, so I'm going to have to really do a deep dive. They said, do a deep dive. So I did, but I have my toe in the water. So tell me your hacks with this.
Yeah, well, listen, these peptides, amino acids that are essentially software packages that you're injecting into your body or taking orally or taking it through a patch, and you're stimulating a biologic process that's not working at its best, is essentially what you're accomplishing here. And there's ones for helping you stimulate your own growth hormone secretion. There's other ones to help your adrenal glands and your testes to make more testosterone. There's ones that are actually good for reflux and gut issues. BPC 157 is very famous and very popular these days, and can be used for joints and gut because it has so much to do with improving how those tissues and collagen behave. TB 500 is another one that's usually the sister molecule with BPC 157 because it works
So
on
what is your dosing
collagen.
on those? What's your
Oh my
dosing on
God.
those?
There's so many peptides out there. I have my little laundry list here somewhere, but I think
Well,
it's
I'm going to have to come in your office and
yeah,
copy it.
yeah. But so what about microbiome diversity? So what can we do that's going to make our microbiome flourish?
So, a healthy gut is a diverse gut. And the more healthy microbial life that you have from your north to your south, because every single tissue in your body has a biome. But right now, we're talking about the biome in the digestive tract, which really starts in your sinuses, because everything in your sinuses drips down to your mouth, and everything in your mouth drips down to your esophagus, which drips down southerly. So you really have from your north to your south. That's the deal. You want it to be diverse as possible. And the number one driver of diversity is diversity of food choices. And one of the things that most people do wrong, that's the simplest to change, but for some reason habitually it's not, is eating a very diverse diet, because most of us eat a monotonous diet. We eat about a variation of 5 to 8 foods, and they're eggs and wheat and cheese and a few other things. If we eat a salad, it's almost exactly the same salad. If we eat some vegetables, it's almost always broccoli or carrots, or the same exact vegetables. And it's very important to eat very different foods, very different colored foods, foods from different countries. The more diverse that you can stretch yourself, if you have to go to different restaurants that come from different countries and you're not a cook, that's one way to do it. But of course, you can't really have any control over the oils and the different things they use. But a
Bingo.
diverse diet is really the key to a real healthy biome. And all of your biomes chit chat with each other through commensurable conversations. They all get together and have a unified, like they have a megaphone in front of them, and they affect each other. You have your vagina speaking to your heart. You have biomes in your breast.
Yeah.
Women with breast cancer have altered breast biomes. So the best thing you could do for all of your biome crosstalks is to eat as diverse a diet as possible.
And what about prebiotics and probiotics? What do you think about using those on a regular basis?
I think we've gotten too nutty. If you eat a really healthy diet with garlic and leeks and this and that in it, you've got it all in it. Otherwise, all you're doing is popping pills all the time. And
Mhm.
I don't know how healthy that is. So people are very into these prebiotics, postbiotics, ultrabiotics, and and even though probiotics are great, they don't do exactly as much as a diverse, healthy, organic diet will do and exercise will do. So if you want to take pre and postbiotics, that's fine. But if you eat a diverse diet, many of the foods that you consume, like I always make sure that I get a leek in once a week and I make sure that I get garlic. These are all natural prebiotics. And, you can get, I make all my own kimchi. I get together with Neil here in town. We've been doing it for 13 years now. We make 50 quarts of kimchi and we raise our own black Spanish. I mean, I've been a health nut since I've been a teenager, and I am going to be 77 in a few months. Yikes. And I feel like, I've been through a lot because my mother was given this horrific drug so early in life. I had cancers and battled blindness with partly with the glaucoma and so
Lindsay,
forth.
Lindsay,
And
you are the epitome of epigenetics because you don't look 77 even close. So you're doing a
oh,
great
from
job.
your
So
lips
whatever
to
you've been,
God's
yeah,
ears.
so you're looking great. And the amount of physical activity that you're doing and still have the energy to sit and talk to boring old me afterward is amazing.
And I only have one adrenal gland. Every time I shadow Dr. Sam Rabar, he'll be talking to a patient, and then the patient leaves the room and he'll lean back and he'll go, everybody's exhausted. And you're living this huge life with one adrenal gland. Tell me your secret. I go, diverse food, diverse food. I don't know. Of course, it's many things that you do, but we're passionate about our work, but we do you and I both exercise a lot.
Mhm. Yeah, I wish I could exercise even more consistently, but sometimes life gets in the way, but you have to schedule it for yourself, is what happens.
I
So,
always say you exercise has to be like brushing your teeth,
yeah,
non-negotiable. Okay.
agreed, agreed.
But
So,
hormones are okay. I'm going to shut up.
I
Okay.
just wanted to do one more question from a diet
Okay.
nutritional perspective. So, what's your
Okay.
take on the oils and what people get exposed to? You just brought it up a moment ago. What people get exposed to on the outside versus what they're using to prepare their food at home. What should we be doing as a biohack there?
Well, it's very interesting. I just had Frank Schallenberger, who's considered the father of the godfather of ozone. He just spoke to my pro group. I have a group of doctors and pharmacists and so forth that I have meetings with every month, and I've been doing that for a number of years ever since COVID. And he came and spoke with us all, and he said, the real issue with the downfall of American health started when they processed seed oils. And he said it's not the seed oils themselves. So people shouldn't be frightened of seeds because seeds are great foods. It's the processing, the way that they process these oils. So it's good. There's certain oils that are really healthy. Avocado oil is healthy. Olive oil is healthy. Macadamia nut oil is healthy. But when they start processing, and I guess a lot of crime elements have gotten in on the olive oil industry because it's such a big money making, and you don't know who's really taking care of you. And a lot of these vats they're made of plastic, and there's a lot of microplastics and things. So it's hard to know what to use. Butter is a great source because it's got so much butyrate in it, and it's a whole food and it doesn't have those same issues. But at home, I basically use avocado oil for cooking. I use olive oil in my food than when I don't heat it because it doesn't have, it has a lower flash point than avocado oil. And I use butter now. I just don't worry about it. And I enjoy butter, especially because of the butyrate component.
That's
So,
great. And then as
and
we do,
also coconut oil is
yeah,
healthy, but I don't like the flavor of coconut very much, so
me
I
neither.
avoid that because I also feel people should love their food.
Right.
I don't want anyone to eat stuff that you don't enjoy because I think enjoyment is a big we should enjoy life because so much of life is difficult and
Mhm.
harsh. So I encourage people to eat well, but find things that are healthy that you enjoy eating well.
And then the other point is also fatty acids in general, right? So I make it a strict point in cardiovascular patients and in everybody really to severely minimize your pork intake because of the omega-6 content that's there. I think if you're going to be eating beef, try to stay with the grass-fed as much as possible because that meat will actually be higher in omega-3 than omega-6.
Yes.
And same thing with the butters and the beef tallows. You want it to be coming from a grass-fed source. Luckily, I'm Greek, so I have a lot of grass-fed animals that I love to eat. And so
Luckily, I'm Jewish, so I don't eat pork.
there you go. So I do make it a point. And then the other thing is big fish. Big fish more for a metals reason than anything else. So I do try to tell people, try not to eat so much of the salmon and so much of the tuna and the grouper. You should try to eat the smaller fish.
So which fish do you recommend?
Well, I love Loup de Mer. That's my favorite.
What
But
is that?
it's a Mediterranean fish. It's a little bit smaller, very flavorful, awesome stuff.
So
You
when
got
you and your wife have me over for dinner, you're going to
yeah,
cook this
yeah, sure, we can
when
do
I move
that.
to Naples?
Absolutely. Absolutely. And then I think we can't finish this conversation about gut and heart if we can't
Okay.
incorporate some hormones in there. So what is it that will help the gut? So let's say someone is menopausal or manopausal. What is it that is being helped when you're actually going through bioidentical hormone replacement when it comes to the
Well,
gut and heart?
so hormones are the most powerful signaling molecules we have in the body. And we used to think, up until about 10 years ago, that hormones needed to seek out target tissues. That's tissues that had a lot of receptors or satellite dishes to receive the signal of that hormone. And the gut is just flush with receptors, especially for thyroid and for estrogen and testosterone and progesterone and oxytocin's best friend, vasopressin. But in the last 10 years, we discovered that hormones can deliver their signal without a satellite dish. They can just deliver their signals to all cell membranes, every single cell membrane. And the more that your cell membrane is healthy and fluid, which means the more essential fatty acids and fish oil that you consume and the less omega 6 and ultra processed foods that you consume, the more you get those signals. So hormones signal your entire digestive tract. The only place they don't signal is your gallbladder because it's a piggy bank and it doesn't do much. So your pancreas is signaled by hormones, your esophagus is signaled by hormones. One of the reasons we get more esophageal issues as we age is we get less protective hormone signals. So hormone replacement helps keep your north to your south healthier for longer. Nothing's going to make you immortal and completely nullify your expiration date. Oh, if it was only so, Rapunzel, that we could really get that fairy tale working.
Mm.
But it will slow down the acceleration of the Mack truck of time. Hormones make a huge difference. They don't cause cancer. This whole issue with everyone being frightened, and then it got really the fear got amplified because we're such a reactive society that after 2002, when the wrong interpretation of the first Women's Health Initiative came out, med schools stopped teaching hormones, osteopathic schools stopped teaching hormones, naturopathic schools, nursing schools, nobody taught hormones. In fact, there was a survey they took place with OBGYNs who you think are the caretakers of female hormones. Only 31%, and this survey came out in 2023, only 31% of them had ever had a 5 or 6 week course on hormones. They knew nothing about hormones. So it's human to be down on what you're not up on. So if you have no training in it and you're well-intentioned, which most doctors are,
Mm.
and your patient asks you, do you think I'm a candidate for hormones? You're going to hear no, because that person doesn't know about hormones.
Right.
That's why I've been trying to do so many CME courses for providers over these last few years. I just put on one with David Brownstein, 16 hours at CME called Everything Hormones. And we had almost 300 doctors from 7 countries, a lot of OBGYNs and urologists, and they all said to us, we have known nothing about hormones. Thank you, thank you, thank you. So hormones have a lot to do with not having reflux, with not having microscopic colitis, with having healthier bowel movements. And ideally, you want to have 2 bowel movements a day. That helps keep your hormones healthy, and hormones help you more likely achieve it. That should be a goal. And I specialize now in breast cancer as adjunctive care, not as main care at all. And the history in most of my patients are that they have had a history of constipation, or they only go a few times a week, and they've been on birth control pills. That is kind of the recipe to create this vulnerability. So you do want to have great hormone health to maintain great gut health, which helps you have great heart health. Everything is connected. Yay in that unity. But the important point is stay away from the junk food, get back to basics, drink a lot of water, and find some exercise that you will love and continue to do because you really got to train for your life. I tell this to my cancer patients. You have to train for your recovery like you're training for an Ironman. The
Right.
fitter you are, the more you can have dirty nooks and crannies, but get away with it. So you want to find things that you enjoy doing and you push yourself. You get really into the pushing that cardiorespiratory fitness. That makes a huge difference in life,
That's
even for
great.
your gut.
That's great. So last but not least, how's the book coming along? When is it going to come out? When can we get it?
Okay, so it's called Oxytocin Medicine. It's my 22nd book. I'm so excited about it. It's been a long time coming. I feel like I've been constipated, but it's out. It's coming out in September.
Okay.
And it's actually, the indexing just got done in the last few days, and the final interior design is being done this next week. The cover is done, and everything we're ready to go. And now all we're doing is setting the marketing forward. So it's very exciting because the most powerful hormone in your body is the love hormone because it's the hormone that rules birth, and the baby is awash in it. The mother's awash in it, the baby is awash in it, and it's the hormone that says life is good and
Mhm.
you should feel good about being part of humanity. And it's the most vulnerable hormone to pollution of any hormone. And I link disruption of oxytocin signals to possibly school shooting and our need for all these, mood regulating psychotropic medications. And then I go through different issues of how you can use it in practice. And the 12th chapter has how providers can actually write a script to a compounding pharmacy for multiple issues using oxytocin in clinical practice.
So is your premise that the young kids that for one reason or another they're getting put on SSRIs and they're getting involved in very violent things that maybe oxytocin is the problem to begin
Well,
with?
oxytocin insufficiency.
Yeah.
There's a number of studies. Well, it starts with Pitocin. Half our births right now in the United States are Pitocin oriented, and Pitocin is oxytocin,
Mhm.
but oxytocin is the only hormone that's really pulsed. All other hormones you can give in a steady state. You go on hormone replacement therapy, you're taking it daily. But
Mhm.
oxytocin is pulsed in a healthy person. And there's articles that kids who are born with Pitocin, which is not pulsed, there's a much higher incidence of ADHD, of autism, of different issues. There's certain foods that turn oxytocin on, certain life behaviors that turn oxytocin on. Oxytocin helps us feel all right with our world, and most of us don't feel all right with our world. Now, there's many reasons not to feel all right, but it really does come, most of the powerful signals that give us a sense of mood inside of ourselves are really hormone based. And oxytocin is that hormone that God and nature created to try and keep us harmonious, and it's not working right now. So I discuss that in the book and
Is
kind of
it
go
being
into a philosophical.
is it pulsed diurnally once a day? How is it
It's
pulsed?
every 3 minutes. Every 3 minutes it's
Wow. Okay.
pulsed in an adult. But in the baby is awash in it, and there's a tremendous oxidative stress on the baby's gastrointestinal lining from birth to the very first time the baby feeds at the breast or whatever way the baby is fed. And
Mhm.
oxytocin from the mother's body, because oxytocin is also a contractile hormone, so it helps the uterus contract to push the baby out, and then it's going to help the breast contract for lactation to take place. So the
Mhm.
mom's body is awash during the birthing process with oxytocin. And when the baby becomes awash, it helps keep the real baby new villi, the little finger projections into the lining of the gut, it keeps them safe. And throughout life, oxytocin has a lot to do with keeping our gut safe, but nobody knows about this. So
Mhm.
I've actually created an esophagus medication using oxytocin and mucilox, and we've been using it in a number of patients. And for Barrett's esophagus, we add another component, and I go into all of that in the book. So it's the utilization of the love hormone and the birth hormone for different issues in our tissues. In
I
fact, the name
can't
of the book
wait.
is Oxytocin Medicine: How to Use the Love Hormone for so many issues in various tissues. I can't remember the whole subtitle right now,
So I definitely
but
want you
I'm
to come back
excited.
when it's out. I want you to come back so
I
we can
will.
discuss
I
it,
will.
and that'll be awesome. What a great topic. I love it. All right. So that's the end of the podcast this time. We have a few other ones coming down the pike. And Devaki, you were wonderful once again. Thank you so much for sharing all your
Oh,
knowledge, especially, I mean, I consider you a major expert when it comes to the gut stuff, especially, and the hormones, of course. So I look forward to having you back sometime soon. Are you okay with